This is Dr. Koenig, and this is part two of the lecture for Chapter 3 in Assessment and Evaluation. And I'm going to flip over here. So, if we are assessing an individual with a disability, we have to make sure that we are accommodating them. The definition of a person with a disability is someone who has something that is going to substantially limit one or more major life activity. So if they meet that requirement, then they fall under the definition of being disabled, and that can impact their ability to be fairly assessed, and we may need to make accommodations for them. So as far as IDEA, these are the disability categories for children. As you can see, if we have someone who is deaf, blind, some type of emotional disturbance, visually impaired, traumatic brain injury, there are ways in which we may need to modify our assessment strategies to accommodate that disability. And some of those strategies could include the presentation format, the response format, the timing by extending the time, the test setting, certain portions of a test, or using substitute or alternative tests. If we're assessing someone with a visual impairment, the accommodations can be divided into 5 categories. It's whether it's presentation related, time related, setting related, response related, and aids as in some type of testing aid. So if we have someone with a hearing impairment, we want to make sure that they can understand spoken language. So we may need to have them assessed, their hearing assessed, before we're doing the psychological assessment or the clinical assessment. We want to make sure that our testing environment is free from distractions. And well, anyone who has a mild hearing loss can be really, really impacted by extraneous noise. So even if we're not having to make other accommodations for them because they don't have a profound hearing loss, if they have some type of hearing loss, we really want to make sure that we're attending to the environment. We don't want visual distractions, especially if they're reading lips. We may need an interpreter. We may need to alter our seating arrangements. And we may need to actually have multiple assessment approaches if the construct in question is something that is directly related to the person's disability. So we have a couple more terms here. An intellectual disability is today, or ID, is what we used to call mental retardation. So mental retardation, we don't use that term anymore. We're going to use the term intellectual disability, or ID. Adaptive functioning refers to basically the way that a person has learned to overcome any limitations to functioning in their everyday lives. So sometimes people have really good adaptive skills. They've developed a way to adapt and function that works around or helps them to manage any impairments that they have as a result of their disability. So if we're assessing someone with a neuropsychological impairment, and I don't really imagine that we would do that unless we were working with a psychiatrist or a psychologist, and that was just our full-time job. In that case, we may. I guess I have used the Bender before. I worked in a prison, and believe it or not, it's highly believable. We had a lot of individuals in a prison setting who had traumatic brain injury. So we did use the Bender quite a bit in order more as I would use that more as a screening before sending them on for more testing if I felt like that was something that was impacting them. So we're assessing someone with a communication disorder or a language disorder, speech disorder. We want to make sure that we are very accepting of the individual, that they're not getting some vibe from us that they are lesser than. Absolutely do not want to do that. We want to make sure that we're using all of our basic counseling skills, and unconditional positive regard is part of that. We want to remove any distracting stimuli from the testing environment. Keep the instructions direct and simple. We can repeat or rephrase as is appropriate. We want to watch their facial expressions, make sure that we're reading their body language. We can allow them to nod or point or, however they need to indicate what their answer is. If we are assessing someone who's on the spectrum, we want to make sure that we're aware that they can be impacted, their social interactions can be impacted, communication, they may have repetitive behaviors, and that their senses are something that can be impacted by this particular diagnosis. If we're assessing someone who is ADHD, we know they're going to have issues with attention, hyperactivity, and impulsivity. Be prepared for that as you're going into the assessment. You may want to accommodate that in some way by breaking the assessment into smaller pieces. This also lists some of the assessments that are used to evaluate a child's behavior. Developmental delays. A developmental delay means that a child is developing slower than normal in one of these areas, and because of that, they're at risk for academic failure. So those areas can be physically, cognitively, in communication skills, social, emotional, or adaptively. There are standards that we use when we're assessing someone who is from a diverse population. There are several of them, and you can see the list here that there's multiple standards put out by different organizations. And that is the end of chapter 3.